Happy Monday, everybody. We are back for another Monday Miracle, and I am talking all about how nervous system focused chiropractic can help strengthen the immune system. And specifically for this story, we're talking about recurrent chronic ear infections. So we had about 16-month-old start care with us, and he had been on back-to-back antibiotics for ear infections. And mom and dad were just looking for another way. It just wasn't working. Yes, the antibiotics killed the bacteria, but then the ear infection just coming back. They were thinking about tooth. They didn't love the idea of putting their 16-month-old in for surgery, so they were just exploring other options, and they found us, and we were able to help, which is awesome. So here's the story. We started working on things. We started with our nervous system scans, and what we found for pretty much all the kids that come in with that recurrent ear infection immune system is that there is a lot of stress hanging out right in this top area of the neck. And the reason why that is so important is that when stress gets stuck there, it does two things. One, there's a big immune system hub in there. So when stress gets stuck in our neurospinal system, it doesn't allow the nerves to function optimally in that area, and therefore the immune system starts to not be as resilient as we would like it. And so therefore it's not able to fight things off as often, right? So all kids are exposed, so many kids at least, are exposed to all the germs. But why do some kids then come down with that sickness, that ear infection, that respiratory infection, and some not? Because of the resiliency. So are they able to fight it off or not? But the more interesting thing that we find over and over again, what the science shows us, is that when we have stress up in here, when kids are young, their eustachian tubes, which help drain their ears, are more horizontal. As we get older, they're more vertical. And so when they are already more horizontal, they're already harder to drain, right? So then when you add more stress and tension in through the nervous system and in through the spinal column right up top here, all of a sudden now that just makes those tubes even more horizontal and even harder to drain. So what happens is, especially around that age, 12 to 16 months, when teething starts to happen, there's more fluid in the mouth, more fluid right in the ear area. And so we're starting to now have stagnant fluid in that area if it can't drain, which is a perfect environment for bacteria. So what happens if they get an ear infection? It can't drain, it's in that stagnant fluid, gross. You throw an antibiotic at it, yes, it clears out the bacteria, but it never cleared out the stagnant fluid. Therefore, the second it has another chance, it just starts to come right back. And that's how we end up with kids coming into the office that have been on multiple rounds of antibiotics before they're even a year, or certainly before 2 years old. And this kiddo, the reason why I wanted to tell this story this week is because last week, dad came in, and this kiddo then has graduated to wellness, which is awesome. So he just comes in once a week. We're just making sure that as he continues to grow and develop, and there's some other goals that we're still working towards as well. And dad said, you know, he's been kind of pulling at his ears just a little bit. And as any of you parents know that have been through recurrent ear infections, that is not something that you want to see. So they took him into the pediatrician, and the pediatrician said, no ear infection. There's a teeny little bit of fluid in there. Here's an antibiotic. Don't use it yet, but if you need it, here it is. So they brought him to us instead, and we started working on things. And sure enough, they come back, and things had started to drain. And so that was a really awesome learning experience for those parents, because two things happen. One, kids get sick, right? We don't expect kids to come in here and all of a sudden just be totally resilient and never get sick, right? Kids are gonna get sick. In fact, they get sick a decent amount. So do we. It's not about not getting sick. What it's about is when we do get sick, can our body then create the proper response to win that battle, as opposed to the immune system not quite able to step up to the plate, if you will, and therefore our system gets totally overwhelmed, and maybe it lingers and turns into recurrent and chronic challenges and all those things. So yes, his immune system probably came into contact with a little bit. He's probably teething a little bit. There was a little more fluid in there, so we started to tug at him just a little bit, but then we were able to get in there, adjust, clear that out of there, and boom, he's right back to where we want to be. And since then, everything has been awesome. So that I just thought was a really interesting story about how the immune system is so incredibly connected to the nervous system, how we can help with the immune system, as well as the nervous system. And then also, even when kids start to get better throughout our care, it doesn't mean they're invincible, but what it does mean is that we give their body more adaptability, more resilience, and a better chance to fight off anything that comes their way. Happy Monday Miracle.